Hello and welcome to Lunch Break with the Village. I am Yvette Young, Associate Vice President of Training and Advocacy at the Village. We are so glad that you are able to join us today. Our guest for today's episode is Tiffany Donelson, the President and CEO of Connecticut Health Foundation, and we're going to be having a conversation about no health equity without racial equity. So we're really excited about this conversation. We know that there is a great deal of health disparities across communities of color, and that there definitely needs to be a constant sort of focus on this issue so that folks who are in need can get the care that they definitely deserve to have. So I'm really excited about this. Tiffany, welcome. Thank you so much for spending a bit of your day with us today to have this conversation. I'm sure it will educate a massive group of individuals, and they can then also learn how to advocate for their rights where health equity is concerned. So with that said, the first thing we need to figure out is, who is the Connecticut Health Foundation? What do you guys do?
Well, first, thank you, Yvette, for having me. I really appreciate this opportunity to talk about a topic I'm really passionate about and also focus of our organization. So, the Connecticut Health Foundation is the state's largest health philanthropy. So, we are a foundation and we are the largest one that's solely focused on healthcare. And we, as an organization, since 2014, have been explicitly focused on health equity for people of color in the state. We do have an endowment and we do grant making from our endowment every single year, but we also recognize that the dollars that we spend are very minuscule compared to the over $30 billion that's spent in healthcare in Connecticut.
Mhm.
And for that reason, we focus on systems change. And we define systems change as legislative and administrative policies that really change the way that care can be and should be delivered here in the state. And by focusing on policy, our goal is to reach many with few dollars by changing the system.
Oh, excellent. No, I like initiatives that focus on systemic change because typically that's how we change overall, right? And that's how we move needles and how we get to the place that we need to. Because sometimes when it's individual by individual, it never really manifests in a way that you need it to. So I really like that legislative and systemic focus because that's where we kind of sort of rubber meets the road and we can actually shift and transition. And I think sometimes people fail to realize how important those lawmakers are in ensuring that care is provided adequately and fairly across all communities. So glad that that is the central focus of your foundation, and the fact that your foundation exists to be able to do this work is a blessing within itself, and have the endowment to be able to continue this hopefully for years to come. So health equity is central to your work at the Connecticut Health Foundation. How do you define health equity?
Well, we want to create a state where people have the opportunity to live their healthiest lives as they define it
Mhm.
without any barriers due to race, socioeconomic status, how they identify related to their ethnicity, and any other barriers that we see that typically prevent folks from being their healthiest. So we define health equity as advancing a system in which people have the ability to live their healthiest lives, again, as they define it.
Okay, excellent. And so why is racial equity so central to health equity?
Well, when you mentioned the idea of systems, we know that a lot of our health inequities are really built upon systemic racism. And
Mm.
systemic racism, meaning some of the prior laws and even how we've executed that have prevented people of color from having the ability to live their healthiest lives. And I'll just give a simple example of looking at laws, for example, around redlining. And
Mhm.
that is when literally lines were drawn where people of color could not purchase homes in certain areas. And what we have found is if you do an overlay of some of the top health disparities, asthma, diabetes, hypertension, it still aligns with the redlining that occurred 50 years ago when people of color were not able to purchase homes in certain areas. And that is because investments were not made in areas where people of color have lived and were living, even in the past and even today. And so we see that some of the prior systems that were designed to prevent equality are the same systems that are creating inequalities in our healthcare system. And so we know that there are many factors that impact one's health. But what we've seen over and over again, the data, is that the racial disparities are prominent, regardless even of social and economic status. So I
Mm.
started with talking about how we have lived out systems of the past, but even in the present, there are so many indicators that show us that race matters, even in the event of social and economic status being equal and education being equal. For example, CDC, other folks continuously use a statistic to talk about this, even in maternal health, that a Black woman nationally is still 1.6 times more likely to die if she has a graduate degree.
Mm.
She's still 1.6 times more likely to die than a white woman who does not even have a high school diploma. So when you look at data like that, we know that there are layers and layers of a system that was built on inequality, coupled with a system that still remains unequal, even if people strive to reduce some of the gaps in socioeconomics. The last thing I will say is that the data also shows us that when people of color enter the healthcare system, they're treated differently. And these aren't studies that were just done by small groups. These are studies that have been done by and published in major medical journals around how people of color are less likely to get pain meds with broken bones. They're less likely to have extreme or the right interventions if they come into a system with cardiovascular issues. So there are studies after studies that indicate that people of color are just not treated equally even when they enter the system. And that is all built on a system again of inequality. So we built the US on inequalities and our healthcare system is just reflective of that.
Thank you for that. And I know that you sit on the Commission for Racial Equity in Public Health, right? And we had the executive director on the show last year, and she shared with us the report. And part of what you were describing with redlining and showing that even those communities are still struggling across different sort of social determinants of health, be that those decisions back then, those practices back then are continuing to haunt communities of color to this day, right? And I like the fact that you emphasized the wealth piece as well, because there is a wealth gap and that does make a difference. But even when it comes to health related issues, even if you're a person of color that has wealth and has resources, you still can experience some health inequity issues in your care. And I think people, think that it's about if you have more money, your life will be spared, and that is not an accurate statement. So I like the fact that you emphasize that as well, that still continues to be a factor for communities of color. So when we talk about, policies and practices, they're usually not built on one racial or ethnic group, right? So how do you create change that will have the impact you want through those systems?
We look at it as a foundation of creating solutions for the least of them that would also help the most of them.
Hmm.
So, starting with designing solutions for those who are most disadvantaged also helps those who are not as disadvantaged. So the idea that you can essentially rising tides will lift all boats. And so that's what
Mhm.
we're trying to do in the system is to rise the tides and have all the boats that are lifted. And so, technical terms in the field is looking at targeted universalism, which is meaning that you create broad strategies, but you also target again populations that
Mm,
need it most. So the perfect example for us is as we are looking at access to coverage. So if we are considering Medicaid coverage, for example,
mhm,
we have really been trying to fight for the expansion of coverage, particularly for people of color, because if you look at the data, that's who's not being covered most like are primarily people of color. So we created policies and we continue to create policies that's looking at access and expansion of access. And there have been laws in our state. We appreciate our state for creating solutions like Cover Connecticut and for expanding Medicaid for undocumented children and undocumented pregnant women. We greatly appreciate that. And that helps everyone, essentially. If we expand rates, it helps all the working poor who are in our state. But we continue to drill down and target as a foundation. So we will create and help to think about those policies. And when I say create, meaning as an organization, we will think about ways and mechanisms, provide research and advocacy around some of these policies. But then we focus on the implementation. So it's not just okay that we have passed these things. We will then invest in assuring that communities of color know that they have access and get access because sometimes these policies are created, but they're still not reaching the folks who we need to be reached. And so we do both. We think about the policies that will impact people of color, that will also help our state writ large, and then we think about how do we assure that we are targeting the population to really get them involved and to also get them understanding what they have access to and rights to.
awesome. I loved from you started with the analogy about the rising tide and how if you lift a few, you could then lift all. I think that's brilliant because I think oftentimes people assume or think that if you're helping one population of people, that means that everybody else is not receiving some support and services. And I really like the fact that you said if you help those who are greatest in need, it will trickle and benefit the others as well. So thank you for clarifying that because it takes away that like, well, why them? Why not all of us conversation? Because those are the ones who need it the most right now. And anything that is built or developed will then make sure everybody is getting equal treatment across the board. So
And I will use another example. I mean, just like our organization is now going to focus on building a maternal health blueprint, but it's going to center around reducing inequities. Well,
mm,
the blueprint around that will help all women in the state
mhm,
of Connecticut. We are focusing on women of color because the disparities are dismal, but we will create things that will help all people here in our state. And that's what we need to keep in mind is that it isn't a zero sum game. And I
mhm,
know that folks have talked about that, but we continuously need to reiterate that it's not a zero sum game. We all win when we are all winning. And
exactly.
that's what we need to focus on.
Brilliant. So as we're talking about strategies, what are some of the strategies do you think will help to address racial health disparities?
So there are a variety of strategies that we are looking at as an organization. And I will say that in so many ways, there are some things that are immediate, and then there are some things that are longer term that we
Mhm,
really need to think about. So some of the immediate things I already mentioned is looking at coverage, just making sure that people have access to walk through the doors of the healthcare system is really, really important. And even as I'm thinking about coverage, so an immediate thing is making sure people have insurance coverage. A long term piece is making sure that they have adequate access. So thinking about assuring people have access to primary care and specialists in the way that they need. So immediate and long term.
Mhm.
Another is around community health workers. We know that when individuals are working with people who reflect themselves and who reflect their culture, their health outcomes are better. So we as an organization look at community health workers as individuals who are from the community and of the community. And we really do have a broad definition: peer support specialists, navigators, all of those titles that we often hear for us fall into the bracket of community health workers. And we know that community health workers are important for helping people navigate the system and connecting them to the social needs. So, an area that is immediate is assuring that community health workers are funded and sustainably funded, meaning assuring that there is a way to have them funded through commercial and Medicaid, and we're proud of our state for the fact that they are now allowing community health workers to be funded through Medicaid. That is a huge step. So that's an immediate piece. Long term is thinking about how do we truly integrate community health workers into our healthcare system and into our social services system, both. How do we truly integrate them? The other area that I think that we can continue and that our organization looks at is understanding the problems that we are trying to solve with accurate data. So we have data around health disparities, and it often comes at a lag. We are a year or two behind in getting data. Sometimes it's not real time. So our organization is focused on the standardized collection of race, ethnicity, and language data from our health systems directly. And let me specify self-reported race, ethnicity, and
Mhm.
language data. So getting our health systems to ask the questions of patients around how they identify their race and ethnicity and language, and being able to aggregate that data so that we have it real time, so that we can build interventions, not 1 or 2 years behind, so that we can build interventions real time by looking at the population and what their issues are. The last a couple of things I'll close this question with, because there's always a lot,
Mhm.
is, the state has the ability to do racial and ethnic impact statements for our legislation. And we really need to continue to utilize that as a state. And so, what this really speaks to is thinking about how policies that are being proposed impacts individuals of color in our state and impacts the health disparities in our state. And so one of the things that we are really encouraging folks to focus on and continue to do is to look at those racial and ethnic impact statements for our legislation. So we are making sure that we are creating interventions that truly will help people. Long term, we would love to see our healthcare system use evidence-based practices for all. So regardless of race, using evidence-based practices and guidelines and also being reimbursed for that.
Mhm.
So getting to a point where people in our system can come through and get the same care no matter what, and to the point where our health systems are really being rewarded for keeping populations healthy.
Awesome. So, in your discussion around strategies, you mentioned a few of your key priority, legislative priority or advocacy priorities for 2024. Do you want to just share with our audience what the other ones are, and so that they're aware of like what your foundation is doing, and so they know how they can support those if those are areas of interest and passion for them.
We are in a very interesting time related to our finances as a state and
Mhm.
in general. And, we're coming up on an election season. So, what we want to assure, in addition to helping the state think about implementation to community health workers, considering access, we also want to make sure we don't lose any ground. So we, as you probably heard from Parisa when she came to speak, as you've
Mhm,
probably heard from other speakers, as a response to COVID and as a response to all of the racial unrest, there were some great laws that were passed in our state. And we do want to make sure that we are carefully assuring the implementation of that and that we don't lose any ground in the future.
mhm.
And in specific, we look at a variety of areas, but even specifically looking at Medicaid and Medicaid expansion and making sure we don't lose any ground there.
Awesome. So can you explain which populations will be impacted by your advocacy initiatives?
Again, we are focused on people of color, and we are an organization that is very clear that we define people of color as those who are part of the BIPOC community. So,
Mhm,
Black, Indigenous people of color is who we particularly focus on. And again, what we want to assure is that there is no lack within these communities as much as we can, even in these lower hanging fruit areas.
mhm.
And we are in our most immediate plans. Again, we know that community health workers will benefit all, and we really are hoping that our state gets to a point of making sure that those who are just below the poverty line eligibility for Medicaid have access and continue to focus on undocumented children, assuring that they have access to healthcare as well.
So I think legislatively last year there was a push to extend the age from what was it, 16 to 18 for undocumented?
15. So 15 is
15?
supposed to be implemented in July, and there was a push to move it to 18, and that did not happen in
Okay.
that session. And it will, this is a short session, so that's
Yeah.
why I'm pausing a little bit. It may not happen this session either,
Yeah.
but there are, again, preparations and considerations for as we think about our ongoing advocacy to raise the age to 18.
Excellent. All right. So I saw that you guys are going to be celebrating your 25th year anniversary this year. So can you share with us some outcomes you have achieved over the past 25 years?
Yes, we're really excited to celebrate our 25th anniversary. We are having a very large party on June 13th at the convention center. And I'm mentioning that because all are welcome. You know, we send emails out to our partners, but all are welcome. And we have some great speakers who are going to come and talk about equity issues broadly and within our state. So I will start with that. So all are welcome to our very large party. What, the foundation has been in different focus areas among the 25 years. And when we initially started, one of our priorities was around oral health access. And our goal was to assure that children on Medicaid had access to oral health care similar to those who are covered by commercial insurance. And we really built a huge push around that through advocacy, legal action, building collaboratives, and creating a blueprint to guide this. And as a result, in 2013, Connecticut was deemed one of the top states for access to oral health care. And I commend all of our partners along the way who really supported this work and who helped guide the foundation's thinking around this. And we are still often applauded as a state for our for access to oral health care. So we are proud of that. We are also proud of where we have come related to community health workers. So when we
Mhm.
first started this work, community health workers were integrated to an extent into the healthcare system, but they were completely grant funded. Folks were still trying to figure out who they were. And so I'm proud of us for working with some amazing, amazing partners along the way to help build certification for community health workers, to again fight for advocacy and legislation around defining community health workers in our state, and also to get us to the point of having Medicaid coverage for community health workers. And again, the work of the foundation, it's hard oftentimes when people ask what our success is because we are only as successful as our partners.
Mm.
The work is really not about us, it's about our partners. And so I really have to pause and just thank all the people who have been working on these issues throughout the years. The last thing I will say in full candor is that as an organization, when we were starting along the way in our state, people weren't talking about health disparities and health equity. And so I really appreciate that we've raised that language over the past 25 years. And
Mhm.
again, have had partners who have really come along and been with us since the very beginning to raise language around health disparities, health equity, and specifically looking at the difference within different racial and ethnic categories in our state.
No, I agree with you 100%. It hasn't been a dialogue for years. It really, I think, maybe within the last 5 years or so, the terminology, the disparity conversations, the equity conversations have been raising up. So it's a good time for an
Mhm.
organization like this to be able to do some really good work because there's a consciousness there that it is an issue and that we need to address and tackle it. And the beauty of collaborative, right? Like the collaboration partnerships, the collective, the village, like
Mhm.
it's so
Mhm.
critically important in success in doing this work. And so it is always a blessing to be able to find a community of people who are like-minded, who have the similar passion in ensuring that folks in our society receive the aid and support that they need without barriers in place for them, right? And that that equity is truly equity, and not sort of a glossed over version, let's say, of
Exactly,
equity, because we
exactly.
know how that
Mhm.
can go.
Mhm.
It's supposed to be for all, but it really isn't,
Mhm.
kind of thing, because people never took into consideration those individuals and their unique issues and struggles that they may have. So really, really, excited that you guys exist, have existed for so long, and will continue to do such great work. So, with that said, right, what advice would you give to those who are interested in becoming a more active participant in the health equity movement but don't know where to begin?
So, first of all, I will say again, we are only as strong as our partners, and we are always looking for new partners. And so, I would say, don't be shy in reaching out to the foundation if you have any ideas or any thoughts on how we can get to a more equitable healthcare system. As an individual, think about what impacts you every day. Start with your own health. What impacts your own health and how you need to make those shifts. And then think about what are some of the broader systems that prevent you from being healthy. That's often helpful, and it could be in any area. So I encourage people to think about the entire system. It could be in education, transportation. There are so many issues that impact one's
Mhm.
health. Start with what you're passionate about. And think about, again, partners. You talked about collaboration. We are only as good as we are together. We are not going to be great alone. And so, thinking of those who are working on these issues that folks can partner with, I would really encourage that. There is going to be a health equity week coming up. It's
Okay.
the first full week of April. And it's a health equity week in Connecticut that's being really led by our one of our grantees, Health Equity Solutions, who also has a lot of resources. But there is a Health Equity Week that's going to be at the Legislative Office building, and there will be other events. So I would encourage people to get involved in that so they could even learn about ways that they can continue to work on creating more equitable system.
So it's interesting that you say that because the village is going to be participating on the 4th of April at the
Good.
LOB, the mental health symposium or exhibit that's going to be there. So it'll be interesting to see what the other topics are for that week, because that's the one I know of because I'm going to be helping a little bit tabling, but I'm
Excellent.
not sure what the other dates are covering. So is there a way people can get access to what is actually being offered for that full week?
Yes. So if you actually go to Health Equity Solutions website, they will have more details on,
Okay.
because again, they're spearheading a lot of the activities for that week. They will have more details on that. And I really encourage you all. Health Equity Solutions is a partner, we actually are the organization that started Health Equity Solutions, and they've been a partner of the foundations since the onset. And so they will have a lot of great resources for that week.
Excellent. So our timing could not have been better by having this episode
Exactly.
this week, because then we'll be able to get people out there to support that. The other thing that I wanted to mention, you mentioned earlier in your conversation about access. So there was insurance coverage and access. And one of the things, just to put a plug out there for the work that the village is doing and how much we take health
Mhm.
equity seriously here at this organization, is that we have an on-med pod now that is at our Village South site, which is on Weathersfield Avenue, which now gives folks in that community access to be triaged for any medical concerns or issues that they have if they can't get to an urgent crisis center, or a clinic, or to the ED, or to keep people out of the ED for routine medical issues. So that is available on our site. People can go in and if it's available at a time, going to the pod, they will have people who will be communicating and getting information, so that there is accessibility for communities that oftentimes have, like, we always call them pockets of deserts for a lot of different things. It could be for food, it could be for medical care, it could be for mental health services, etc. But we partnered with Hartford Healthcare, and that is now available, actively up and running, for communities, for folks in the Hartford community to access and use. So I wanted to put a plug for that, because you're right, access is always an issue. And in communities of color, sometimes it's a really big issue. And so being able to offer that to the community is a blessing. So I wanted to make sure we got that information out there as well.
Excellent. And I encourage everyone to go to your primary care doctor, get the access that you need to stay
Yeah.
healthy,
So
and
we're
fight
really,
for what the system is not doing to keep you healthy.
yeah,
That's what I
exactly.
would encourage.
And so, you start there, you triage, and then hopefully they will connect you to other
Excellent.
providers for long-term care. But every little thing that we can do to make life a little bit easier for folks who have felt marginalized and oppressed for years is always something that we at the village will always celebrate. And that's why, having you here today, Tiffany, to have this conversation, to really promote the work that you guys are doing through the Connecticut Health Foundation, is going to help our community be aware that there are folks fighting and advocating for and offering resources to help their lives be a little bit better. So we thank you for that. And on June 13th, mark the date, we're going to come and celebrate with you guys, because 25 years is definitely an amazing milestone. So with that said, thank you so much, Tiffany, for joining us today. We really appreciate you taking time out of your busy schedule to have this conversation with us. For those of you who are listening in, our next episode of Lunch Break will be in April. Our focus will be on two of our second chance shops that provides financial support to the organization for the work that we do. And in April, they're going to have an emphasis on pinwheels for prevention, which is really around child abuse, and having pinwheels in the stores, selling those, as well as the clothing that and other items that they sell. So please join us in April for that conversation, and to really be able to connect with people who are just choosing to do good, because this is purely a volunteer initiative. And the women who have led and spearhead this have done an amazing job, and has really supported clients here at the village through their efforts. So that's in April. And as always, if you want more information about Lunch Break, previous episodes, or episodes to come, you can always check us out on Facebook, Instagram, or LinkedIn, and you'll get all your updates there. We appreciate you so much. We thank you for support in Lunch Break with the Village, and we look forward to your continued supports in the near future. And as always, be well.